gram positive bacteria. Okay, gram positive bacteria, basically they will appears blue in color. Fine. So it is of three types. It can be bacilli, or it can be branch filament, or it can be cocci. Branch filament, basically they are a coma or rod shape. So it can be of two types. Okay, aerobic, anaerobic. Aerobic examples are Corynebacteria diphtheria, Listeria bacillus. Listeria is a CAMP test positive. In anaerobic, the example is Clostridium, Cutibacterium or Propionibacterium. Clostridium so reverse CAMP test positive. Now branching filament, it includes Nocardia and Actinomyces. No card. So for card we can obtain the drug of choice, card or cotrimoxazole. Okay, no cardia, it's acid fast bacilli. Since it is acid fast bacilli, it is strict aerobic organism. Okay, I have remember like that's card is placed in a acid. Okay, and card drug of choice, card cotrimoxazole, like that. Actinomyces, drug of choice will be penicillin, and it is anaerobic and non-acid fast bacilli. In cocci, let's see, it can be catalase positive or catalase negative. If it is a catalase positive, answer will be Staphylococcus. It will be in cluster. So next step, see coagulase. If it is positive, it is Staph aureus and it ferment monitor. Fine, and it's the most reliable and specific test to differentiate from Staphylococcus epidermidis. If it is coagulase negative, the diagnosis will be the Staphylococcus saprophyticus, Staphylococcus epidermidis. Staphylococcus saprophyticus, it's a is novobiocin resistance. Staphylococcus saprophyticus is novobiocin resistance. Staphylococcus epidermidis is a novobiocin sensitive and they do not ferment mannitol. If it is a catalase negative, answer will be Streptococcus, which are arranged in chain. It can be strict anaerobic or facultative anaerobic. If it is strict anaerobic, it's a Peptostreptococcus. It is a facultative anaerobic, so it will be a C hemolysis. Hemolysis can be alpha hemolysis, beta hemolysis, gamma hemolysis. Alpha hemolysis basically green in color. Okay, so next step, C optokin sensitive, bile soluble. If it is no optokin sensitive, not bile soluble, so answer will be Streptococcus viridans. Viridans don't have a capsule. Okay, and it is of two types: Streptococcus viridans, mutans and mutis. Mutants, they are most common cause for a dental caries, and Streptococcus viridans are a mouth commensal. If there is optokin sensitive, bile soluble, answer will be Streptococcus pneumonia. It is encapsulated, means capsule is present, and causes lower lobe consolidation pneumonia. There are gram positive cocci which are present in pair, that is diplococci. Fine. With a beta hemolysis, then it will be complete hemolysis, it will be clear. So next step, C bacitracin sensitive, pyrrolidonyl aryl amidase positive. If it's yes, it is a group A and answer will be Streptococcus pyogenes. If it's negative, that is a group B, so answer will be Streptococcus agalactiae. Streptococcus agalactiae is a hippurate hydrolysis positive. Okay, though they are bacitracin sensitive and pyrrolidonyl is not negative, but they are hippurate hydrolysis positive and they also show CAMP test. Okay, that means Streptococcus agalactiae is hippurate hydrolysis positive, CAMP test positive, but they are bacitracin sensitive negative, pyrrolidonyl aryl amidase negative. If it's a gamma hemolysis, so it is basically there will be no hemolysis. Okay, so this organism generally grow in bile if this organism grow in bile acetylene agar, pyrrolidonyl aryl amidase positive. If yes, the answer will be Enterococcus. That generally find in example is Enterococcus faecalis, and this Enterococcus faecalis is vancomycin resistant. Okay, if they do not go in bile acetylene agar, pyrrolidonyl aryl amidase is negative, so answer will be non-Enterococcus. Example is Streptococcus bovis and Streptococcus equinus. Streptococcus bovis is also known as Streptococcus galolyticus. Okay, C here. Okay, alpha hemolysis. Okay, and this is a beta hemolysis and this is a gamma hemolysis, means no hemolysis. Okay, this is a CAMP test. Okay, in middle there will be Staph aureus and there will be arrow, bow shape, butterfly shape hemolysis, and this is called Streptococcus agalactiae and Listeria. Okay, Streptococcus pyogenes is, so it's a negative because see there's no arrow head shape hemolysis. Reverse Camptis for Clostridium perfringens, so they'll bow and tie hemolysis. Fine. Now after see this UTI diagnosis. Okay, in asymptomatic patient, the 10 power of the 5 colony forming unit per ml in midstream clean catch urine sample. For female, it should be found in 2 consecutive urine sample. For male, single consecutive sample. But if they are symptomatic, so in male it should be 1000 colony forming unit per ml, and in female only 100. Catheterized urine sample. Patient has, if catheterized urine sample you have taken, and means you have inserted a catheter, after that you have taken a sample for UTI. Patient has, okay.